Welcome to this webinar session with Ranwash. So we are in a session of sharing on different themes that we developed within the 6 year of interventions. Thank you everybody for your presence and participation to this webinar. I am Rasamwin. I am the principal advisor in behavior change and the uses of services for Ranwash. And thank you for participating to this first webinar of the day. We're going to have a series of webinars to share the different approaches we've been using and I'd like to invite you to consult the website of the project to have the detailed information on this webinar, and you have the address which is attached to the screen. Our theme of the day is devoted to the support we provided to the institutions and all the resources that I'm going to present during this presentation are all available at the www.ranwash.org website. For a brief recall, Ranwash project is a 6-year project from June 2017 to June 2023, and it is implemented by CARE, CRS Watered, and 2 private operators, Push Defense at the time, for a budget up to $33 million funded by USAID. The project worked on equitable access to water and sanitation, hygiene, health, nutrition, and environment. So you can see the 7 regions of intervention of the project. And within those 7 regions, we are intervening on 250 communes. We're going to have 3 components of the presentation. The first question is, why have we chosen those institutions? And the second thing is, how did we implemented the activities? And the third part would be on the sharing of the tools. Why did we support the institutions? Why? Institution support is part of the global strategy of behavior change of the project that was presented before yesterday on a specific webinar. And as recall, we have a holistic system and to address multiple factors like on water, sanitation, and hygiene. And we can see on those red circle, we have the schools and healthcare facilities, which are taking important places in behavior changes related to water, sanitation, and hygiene, and which are also impacting on the households and the schools. And that's why we decided to intervene on the schools and healthcare facilities. Why this strategy? As I mentioned earlier, the schools are used by the children, and the children are influenced in their communities as far as behavior changes are regarded. So at a very, very early age, they are exposed to different practices, and the health trainings are also important, but this is also to expose the visitors to certain types of practices and behaviors for the visitors and the people they visit. We are also working on different sensitization activities done by the health providers and some agents, community agents. When we speak of hygiene good practices, we have challenges to have access to adequate water sanitation services, and we have some challenges on reaching open defecation free. So how did we implement those practices? It is important to have a framework on the systemic approach that we adapted, and we realized that within the time of the progression of the project, actually we have trends to intervene in a clustered manner, and we were concentrated on those wash-friendly institutions with the two different ministries, the Ministry of Public Health and the Ministry of National Education. However, the problem of sustainability is always an issue, and we started to work on the limitations of those institutions. At the same time, we started to use the systemic approach for integrated interventions, and as you can see, the infography on the systemic approach, and this allowed us to understand that we have to address the different elements of the system at the level of the institutions if you want to have a sustainable outcome. We have, for example, to address the strategic planning. Do the institutions have strategic planning to have access to water, sanitation and hygiene? The same as the finance, do those institutions have the budget, the finance to maintain the access to those services? For example, for the institutional arrangements, what are the roles and responsibilities of the different actors at the level of these institutions? And for them and for the others, do they have the technical competences, and so on and so forth? I'd like to invite you to try to understand the systemic approach provided, used by the project, and more especially to focus on the governance aspect of the presentation. So we use this frame to mainstream the systemic approach at the level of the institutions. And when we speak of the systemic approach, we need to understand what the text are stipulating, the central roles of the communes for the providing and the maintenance of the water sanitation and hygiene services, and the importance of close collaboration between the commune and the institutions to ensure the sustainability. We have just two examples of laws, but indeed very important laws on organizations and also on the Code of Water. So here we understood that the communes are the managers of the drinking water and the sanitation supply system, and they're also the first responsible on the planning and the implementation of the operations linked to WASH, and they're also responsible for the management of those infrastructures and the equipment. And when we speak of schools and health trainings during our interventions, that we realized that within the institutions, it's not rare to say that the access to water at the primary school is the responsibility of the students' parents. We met different challenges after implementing different the public and private partnerships for the provision of water supply. So some people were not able to pay the invoices provided by the managers, and which created issues management issues for the management. So we developed an approach towards sustainability and established criteria above the developed criteria in the national guides related to the institutions, to wash-friendly institutions. And as you can see in the slides, we did not just consider the criteria developed in the wash-friendly institutions. We also proposed some other criteria for better engagement, commitment of the communes in those institutions, like the maintenance of those infrastructures, for example. We can also see that the support to those institutions are articulated into 3 elements: promote the maintenance of the services, ensure the development of those services, and make sure that those services are implied to the behavior change. So these are the criteria we have to fulfill: the developability of a committee or responsible entity on water sanitation and hygiene, the availability of fundings to ensure the continuity of and the quality of the wash services, the availability of a maintenance plan and of the infrastructures for each institutions, but also the availability of visual references that we call nudge, that we're going to see later on. But these are very important to help in the use of those infrastructures for hygiene practices for those institutions. And more especially, we use this in schools. When we speak of monitoring, we have 5 big steps that the institutions should follow. First of all, the mobilization of the responsibles in the communes and institutions for better collaboration, and also to address the different issues related to the blocks. As we mentioned, we are using the systemic approach, so we have to consider different elements. Sometimes we need to mobilize the responsible and the monitoring on water sanitation and hygiene. What are the situation in the practices of those of hygiene? So how about the maintenance of those infrastructures? So they have to do that diagnosis. So we're going to see later on the tools to make all those auto-diagnoses happen. After the auto-diagnosis, we have to define the actions to ameliorate the access to wash surfaces and define the actions to ameliorate the behaviors. Most of the time when we do some interventions in the schools and the healthcare facilities, we are limited to the definition of access interventions, and we can see that it's not enough. We also need to look at the other building blocks. So what are the tools we used? So in terms of results, for the sake of sharing, Rush and Wash covered 674 trainings, and thanks to the support of this project, 177 schools have access to those 74 have access to water, and 73 have access to hygiene, and the support enabled institutions to improve these institutions to mobilize resources, for example. So we're going to have a look at the tools. We're going to see the different steps, the tools we used. And the first step is the support institutions, and which are the mobilization of the actors, and then we're going to see the different tools we used for the mobilization of the actors. The tool that we shared with you today are available on the website, and you can also scan immediately the QR code that which is attached to the screen to have access to those documents. So we have, for example, used the plan of, say, a specific session. This is part of a curriculum, a large curriculum for the communal, the commune, the activities of the commune. We also have another session dedicated, devoted to the rendering and the commune actors responsible. The session plan is in Malagasy. This is to facilitate the session with the communes, with the actors within the communes and the institutions, to explain the same way to transmit the messages on the mastery of the management for the institutions, and like in all session plans, we have the objectives. What is the theme? What is the duration of the activities? So this is a session of 4 hours, and with the communal actors, and you can see in details on how we conduct the session. We have to include, we should not just inform the communes that our facilitator are there to mobilize everybody, and you can download this tool. I'd like to take this opportunity to present the website. So this is the website. Ranwash website. And when you look at this, you have the project and the tools we are speaking of. And here we need to enter to the behavior change and use of services and everything. And then you can also have a look at different themes like governance and many others. You have different tools available, the list of the available tools, and below you have the supports to the institutions for the sustainability of the services, wash services. And also for the session plan I presented earlier, you can see that it is here. You have to click on the link to have access to that tool. I also would like to present the commune guides for. So this guide is accompanied by the session plan. We have this tool which is enabling the actors to understand their responsibilities and roles. So these are tools in Malagasy, very explicit and details on the different interventions at the level of the institutions, as well as the role and responsibilities of the different actors. For example, what are the responsibility of the communes, the different ministries, the responsibilities of the health care facilities, the schools, and how we can support those institutions. So these are tools which are very simplified and can truly help us develop through actions. Here, for example, we have a very simple form to help the actors define the roles and responsibilities to provide access to wash services, the same as for the healthcare facilities. So here we're speaking of institutional arrangements. When we presented the system approach, we have to make it explicit, verbal, and it is important to provide very simplified tools in Malagasy that can be used by the actors for them to explicit their responsibilities and for them to take their responsibilities. So these are very simplified tools, but to really change things. Still, when we speak of actors mobilization, we also have used, of course, the national guides on WASH for the healthcare friendly healthcare facilities, and you can download those guides, and you can also get them through the flashing of the QR codes, which are available on the right hand side of the slides. So if you are intervening in the WASH sector, and for the institutions, we all know that currently some processes are ongoing to program the updating of those building, and we do not have yet the final versions. Those guides would be very soon updated by the Ministry of Public Health and their partners, but also by the Ministry of National Education and their partners. So you'll be informed about those updating, and for you to have access to the latest versions. We also have in the websites the criteria, the joint criteria, the criteria for the joint monitoring program globally, and how to classify and how to have access to WASH services by the institution. This is very, very interesting document to understand those global criteria. We also have defined this very simplified guide destined to the communal authority, but also can be used by the head of institutions and the technicians to accompany those institutions and how to accompany them. So, for example, here, this is specific for RunWash, but we have indications on what we have to remember when we support the healthcare facilities, the role of the EAH of the commune. So what are the steps and who are participating into those steps, and what are the expected outcomes from each step, and for the achievements of those processes and steps. We have monitoring tools and evaluation, and those monitoring and evaluation tools would be presented in the presentation for tomorrow, because the monitoring evaluation team are going to take the floor and speak about the tool for data collection used by RunWash. So all these tools are available within the websites. So for the tools related to situation diagnosis, I mentioned earlier that it is very important to establish this right at the beginning of the interventions, and we developed this simplified guide. So when we click on the link, you can directly browse on the website to consult the document. So this is the tool we used to support in the auto diagnosis, who are the actors and what are the objectives of the diagnosis, and how does the activity happen with the different steps to follow. So this is very, very simplified. We have a French version of this guide, this document. So this is to facilitate the identification of the problems, the needs, and the resources of those institutions. We are also presenting the WASH-friendly institutions approach, which is with whom are we working and how do we facilitate all those and how to work on those auto-diagnoses. Here, for example, we have a map of the resources of the institutions. We spoke of the importance of the availability of the resources, and this is to have a global vision of the support, not just to focus on the implementation of those infrastructures, and the state supported the system to ensure the sustainability of those services. And for those tools, we established a tool, we elaborated a tool for water sanitation and hygiene for institutions. If you have the QR code, you can flash on it and you can download the Excel file. It's a file, Excel file, and you can. So this is the file. So this is a tool used to facilitate and to discuss, to enable the institutions to establish a budget line for the maintenance of the services on water sanitation and hygiene. So you can see where we do not have enough time to have a look at everything. You just have to scan and flash the QR code to have access to those documents, and you will see that when we speak of maintenance, most of the time our focus is on the payment of the water invoices, but above the payment of the water invoices, we have to look at the other aspects of the thing. For example, this is the budget allocated for water, but also the budget linked with the maintenance, for example, to buy the taps. And so how can we have detailed and explicit ideas on the processes? And here, for example, as for the sanitation, it's not just to make sure the payments are done. We need to set from the beginning of the project. The institution should anticipate the emptying of those latrines, but also the use of the necessary products to ensure the hygiene and the maintenance of those latrines, like the sponges, the buckets, and many others. And below, we can also speak of hygienes. The institutions should anticipate the budget for the soaps, the buckets, and the pads, for example, for us to have these practices. And we hope that those tools are very, very helpful to you ready to use for a better support at the level of the institutions. And last but not least, we established guides, implementation guides for nudges. Nudges are visuals enabling the practices, the encouraged practices, automatized practices of the hygiene behaviors for the institutions. And in this guide, we have developed those nudges to enable, to support the implementation of those nudges. We have models, we have indications, instructions on how we can use them within those institutions. This is not yet uploaded on the website. You can download the tools. You can. We also worked with the Ministry of WASH on the design exercises of the latrines to be proposed to the institutions. So these are available, and you can also use those tools from the website. So that's all. We have to add, we have collaborated with the Ministry of WASH, the Ministry of Public Health, and the Ministry of the National Education to discuss on how we can improve them, and we supported and we still support the process to elaborate a guide of sustainability. And this is an ongoing process that we're going to share later on once it is available. And we'd like to thank all the actors who participated in the reflection workshop 3 weeks ago. So thank you so much for your attention, and please feel free if you have any questions. Any comments, reaction? If you have feedback on the website and to improve the accessibility and the usefulness of the website, we are open to recommendations. We should note that the RunWash website would be always available even if the project is taking an end, and those tools would always be available. And at the same time, we are trying to improve, for example, the infrastructures, tools on the infrastructures. We also have on the website the list of the institutions supported by the projects available on the website. If you would like to know where the project worked, we also have a YouTube chain, RunWash YouTube chains with all the videos with all annexes. Do you have a specific theme that you'd like to discuss with us, that you'd like to develop more in a specific way? just to share the plans, we have the PPP part. We have phase 2, the climate hazards that we're going to have at 3 p.m. and we'd like to invite you for that next webinar. We have the types of infrastructures we implemented. So here we have lots of files. For example, here the plan of the sanitary block. As I presented earlier, we have the plans with the nudge. So that's it. So all these tools are available on the website, and you can download them, consult them anytime you like, and you can use them in the frame of future projects to ameliorate the water services for the institutions. Any questions, comments? As you can see in the chat, so for today at 3, we have the theme on water infrastructure in conformity with the environment and the climate hazards. And tomorrow we're going to have 3 other themes related to the hygiene, the menstrual hygiene management, and the third theme of the third webinar is on monitoring and evaluation. So we'd like to invite you to follow those webinars and participate to those meetings. Otherwise, however, the webinar is recorded, and if you are interested in re-listening and sharing those webinars to your partners, for those who did not have the opportunity to be part of this webinar, we're going to rapidly upload those webinars on the website, and you can revisit them later. If there is no more questions, if there is no question, thank you, Avo. The promotion of hygiene menstrual at 3 and at 1, at 3, and we also have another third webinar at 7 for tomorrow, at 5 for tomorrow. So if we do not have any comments and questions, thank you so much for your participation, and see you later for the next step of the program. Thank you. Bye.